What got you interested in that, like mental health specifically?
What got me interested in mental health specifically? In 2015, I went through a very bad bout of depression, and I actually tried to commit suicide.
Hello you guys, welcome back to The Dose. It's me, Dr. Robin B, and I'm here with my girl, Alexandria Lightning, another health professional. She's a nurse practitioner, and she's gonna tell you guys a little bit about herself. I was wondering, so we both have an interest. I'm actually in a rotation for behavioral health, and you are doing what again?
I am in a psychiatry fellowship for primary care providers through University of California, Irvine.
Woo! Congrats. She keeps going and going.
Thank you. Yeah, it just doesn't stop.
Yeah. Yeah, education just never stops for us.
So this program was designed because, as many people are aware, there's a huge shortage of mental health professionals, not even just in the United States, worldwide. Yes. Matter of fact, lots of countries don't necessarily recognize the role of a nurse practitioner because they haven't gotten there yet. You're either a nurse or you're a doctor. Yeah. There is no in between. Yeah. However, because the mental health crisis is so huge in lots of other countries as well, some of them will accept a psychiatric nurse practitioner to practice in those countries.
No way. Would you ever do that? Would you ever travel?
Oh yeah, absolutely.
Okay.
Absolutely, absolutely.
That's awesome.
Yeah. So with that said, in order to address this shortage of providers, instead of say you're feeling sad and you go to your doctor, your primary care provider, and you tell them, I think I need to, I'm feeling sad, I need help. Instead of them saying, okay, well, we're going to refer you to a psychiatry specialist, and because of the wait time, that might be a 2 to 3 month wait.
It's hard to get in there, you guys.
So how are you dealing in the meantime? And usually by the time you've actually gone and said something to your provider, you've been suffering for a long time now. Yes. You actually are to the point where now it's getting dangerous, where you might harm yourself or someone else, and that's why you've gone to get help, and now we're pushing you off another 2 to 3 months.
Right.
And most primary care providers, in fact, all of us are trained to deal with depression and things like that. But I think in schooling we get maybe one rotation, and it's just not a very heavy hitting topic in our schooling. So a lot of us don't feel comfortable. And that's why we make the referral. So this program that I'm a part of is basically designed to bring the primary care provider back to the basics of, remember, you learned this in school, let's go over it again. Yeah. This is not something that you have to push your patient out the door to a specialist. Yeah. You can handle it.
You can do this. You can do it. Yes. You know what to do. It's just, it's that confidence level. So what got you interested in that, like mental health specifically?
What got me interested in mental health specifically? In 2015, I went through a very bad bout of depression, and I actually tried to commit suicide.
Oh, wow.
Yeah.
Wow.
So it was bad. It was, I feel looking back, it was definitely situational. Yeah. That's what I want people to realize about healthcare professionals. We're just like everybody else.
Say it again, please.
We go through things too. I was going through a lot of things in my personal life. Yeah. I was going crazy in school.
Think about it. That stress on that.
Yeah. I had 3 jobs. It was, my father was dying, and I was taking care of him. About this. And it's just everything it felt was on my shoulders all at the same time, and it just felt easier if I just didn't wake up. That's how it felt. And the funny thing is, when I started to feel these emotions, I didn't recognize it for what it was at first, but then when I did, I said, oh my gosh, this is depression. Yeah. Let me go get help. So that's what I did. I went to my primary care doctor and I said, I am depressed. I need help.
Yes.
And that was what I was given, the referral to see a psych specialist. They couldn't get me out until 3 months.
Well, I'm just glad that you even reached out to someone. A lot of people, especially like I made a post in the Black community, it's not seen that we're supposed to be tough and we're supposed to, we don't have any mental disorders. There's so many people struggling.
Or if you hear it, psych, mental, oh, I'm not crazy.
Oh, yeah,
that has nothing to do with crazy at all.
At all. Crazy is a stereotype. Yeah. All those terms. It's really easy. Like I said, one life event. For you, you had multiple. So think about that weight. But one little life event, like someone getting cancer or dying, it's like could change someone to become. And it was interesting because in my rotation, we had to get a certificate for suicide prevention and just knowing what it is, because it's crazy how, because there's only like the DSM-5, guidelines. Right. It's not really that much on mental health that we can go by. But like, it's a difference between suicidal ideation versus having a plan. Yes. And so if you have just the ideation, which is just the thought about it, then we shouldn't admit you. Correct. And I'm just like, they're still thinking about suicide. But when you have that plan and that intent, like I have a gun, I'm gonna go do this, I'm gonna do that. It's a different story completely.
Exactly.
So I'm glad that you're the one. We didn't have to find, someone didn't have to find you. You came to them and said, hey, I'm feeling these feelings.
Yes, exactly. Unfortunately.
What?
They couldn't get me in until 3 months out. So at the time that I went to get the help, I was having the ideations. I did not have a plan.
Okay.
But between the time that I went and asked for help and the time that they could get me in, it got worse. And then that's when I tried to commit suicide. Unsuccessfully, thank God.
Thank God.
But it's so funny how after you try to kill yourself, all of a sudden the spot opens right up. So.
Oh gosh.
So even though I was
Did you tell them, and that's what kind of prompted?
Well, no, I got actually rushed to the hospital.
Okay.
Yeah, I had to be like resuscitated.
Wow.
Yeah, so, once you're admitted for a suicide attempt, they make room for you.
Yeah, of course.
So I was able to get in right away, get started on medication right away, get into therapy right away, and I got the help that I needed. Yeah. And I was on it for several years.
And did you take medication for it?
Yes. Okay. I did the therapy, I did the medication. I felt so much better.
Yes.
And the thing is, I didn't even realize how better the medications were making me feel, because it's not like the medications make you feel euphoric.
Right.
But they make a difference in ways that you don't realize until you're on them for a while, and then you say, I feel good, I don't need these anymore, and then you stop.
So that's the number one thing our patients do, and then they have this random panic attack, or like, they're like, oh, it really was helping me more than
I realized, and that's what happened to me.
Yeah.
And I was like, oh, shouldn't do that.
Yeah, so it's at least a year, a year. And then even after that, if you need it, if any other medication interacts with that medication, you stay on your depression med.
Yeah.
It's very important.
Yeah, it's very important. So I don't like that I went through my situation.
Right.
But I am happy that it doesn't have to be in vain.
Yes.
Because again, there's a lot of taboo around this topic. People are ashamed. People think that they're the only ones, or that they can't talk about this to their friends or family. And even when they do go and see a healthcare provider, a lot of them feel a little bit intimidated.
Yeah.
Maybe judged, like they're sitting in front of me and thinking to themselves, she has her stuff together. She's wearing the white coat, she got through school, this, that, and the other. And so I love telling them, hey, I know what you're going through. I don't want you to do what I did, which is try to take my own life. And it just shocks them. And right away, when that comes out of my mouth, you just see the guard drop. The guard completely comes off and drops.
Superhero.
And I'm like, yeah, let's both build this rapport together. I take it very personally that health is intimate and it's personal.
It is.
And I go into a room and patients are supposed to just tell me how many people they've had sex with,
right?
And the age of their first period, and if they've ever had an STD. Very personal things that they wouldn't want anybody else knowing. And they're meeting me for the first time, and I'm asking them these very intimate questions. So I feel like it's only fair if they know a little bit of personal, intimate things about me too. It's fair.
That relationship with the patient will make a difference. You can't be cold. Those are the number one things they teach you, And this isn't make-believe. This was your actual story.
Right.
So sharing that with them, and of course, like as any health professional studying, you really think you're going insane.
Yeah.
It's really, I mean, and then plus personal issues, like I could only imagine. So I'm so proud of you for being brave enough to say it again right here, and that you are going to make a difference in other people experiencing this thing. And you're gonna, that gap that you experience, you're gonna try to shorten
Try
that.
to close the gap.
Yay!
Yes.
Well, that's awesome. Thanks so much. Yeah. And I just wish you the best in your journey, and let us know when you finish that.
I will. It's supposed to be December. So yeah, December 2020. It makes it difficult because I'm actually dually enrolled in 2 different programs. I'm in a doctorate of nursing practice program through one university.
So you are doing that one?
Yes, I am doing that one. And then I'm also in the psychiatry fellowship program through UC Irvine.
Okay, so give us a total number of years that you've been in school towards this goal.
Oh my gosh. About 11 past high school. Yeah.
Wow, you guys. That's amazing.
Don't try to guess my age.
Don't do it. Don't ever guess a woman's age, okay? Black don't crack. But quickly before we go, I was gonna ask you, because we are very similar in the way that we are professional, yet we still have a little, you know what I mean, swag to us. So I'm just thinking, what do you think about these nurse traps, or all, you know, like the photos that we take that are still a little bit, just showing that we're humans too? Like, what do you think that people take from this?
Opinions are like assholes. Everybody has one.
Yes, girl.
You know, I feel like there are some people who are going to turn their nose up. I'm from Indiana. It's a Midwest state. It's like in the middle of the Bible Belt, very conservative. You have people who feel that certain people should act and move a certain way. And if you don't act and move that certain way, then you're a bad person. And they're just gonna feel that way. But you know what? Being in healthcare, we deal with people who feel bad about themselves every single day. And our role, like when somebody comes to you and asks you for plan B, you know, we don't know why that girl's asking for plan B. Was she raped?
Right.
You know, what was the situation? And so when she comes to the counter scared, looking to you for help, it's not your place to sit there and judge her situation of why she's doing what she's doing. And it's not my role to judge somebody either. So, you know, what I put on social media, that's who I am. It's who I am. So it's not like, oh, she's out there and she's wearing this just for the gram. Like, no, I actually wore that day. Yes, I wore that and I went out. And I think it's important that my patients see me that way. Because again, it goes back to building rapport. If they see me, you know, pristine in my scrub pants and my jacket every day, and I'm, you know, serious, they feel like they can't relate to me.
Exactly.
I don't do what they do. I don't understand the pressures that they have. I don't understand society, how they do, because I sit at home reading books every Friday night. Actually, that's what I am doing, basically.
That's what we always do, all of us.
I'm in school. But
no,
you know,
seriously. And if we can respect Kim K from going from that to being a lawyer, if we can respect Sierra went back to school, Megan Thee Stallion, doing what she does on the weekends and then still studying. I mean, everyone's trying to go back and get an education. We don't sleep in our white coats. We don't swim in our scrubs. We are human. We go on vacation. We enjoy sun. You know, I mean, what's the big deal?
You brought up a good point. You said, yeah, even in our younger years, we were going out, we were having fun. I want some young girl right now who's going out and having fun to know when they go on my page and see that I'm doing it too, that I'm so much like them that if they want to go back
this path
to be a nurse or a nurse practitioner or a pharmacist, that is still an option, because a lot of these young people are not even being told that they can do that. Nobody in their life has told them, you can do this. They feel that they have to do what everybody else in their family did or didn't do. And that's, you know, this is not an Indian caste system. You're not just born into a family or a role or a socioeconomic status, and that's where you have to stay. It's okay to elevate.
It's okay. Please stop putting people in a box. It doesn't matter your profession. We're not claiming to be pastors. This isn't something where, hey, there's a dress code to the profession. Honestly, this is a career choice, and we just elevated to a certain level, and we had that certain drive to get us there. It's just, do you guys take pictures at your desk from 9 to 5s every single day? Then why do we always have to be in a white coat? Every single day. So this is a whole nother topic for another video. I love you, girl. Thank you so much for coming. And You guys, I hope you enjoyed the video. Please comment below, like, hit subscribe, and I'll see you on the next time on The Dose.